Have you seen changes in someone you care about that aren't obvious but are worrying over the past year? Many people think that death in old age happen quickly, but the body often sends quiet warnings months or even a year before the end of life. The problem is that most people miss these signs because they seem small at first. Families only realize the clues were there the whole time when they look back, but it's too late to make plans or make those last memories count. This movie talks about 5 important signs that an older person is likely to die within a year. Some of them may be things you've noticed, but thought were just signs of getting older, while others may be small changes that actually show the body's slow decline. The sooner you notice these signs, the better care you can give. Remember to enjoy the important moments with your loved one and make sure that their last days are full of comfort, dignity, and peace. Stay with us until the end because these 5 signs can help you get ready for what's to come, both emotionally and practically. When you know what's going to happen, you won't be caught off guard, and you'll be able to enjoy the time you have left with those you care about. The most important: weight loss. One of the earliest and most telling signs that a person may be approaching the final year of their life is unintentional weight loss. At first, it might seem subtle. A belt that suddenly needs tightening, clothes that appear looser, or on hearty appetite that begins to fade. Many families dismiss it as just part of getting older. But the truth is, losing weight without trying is rarely a good sign. It often indicates that the body is no longer absorbing nutrients efficiently. Muscle mass is decreasing and essential systems are slowing down. Aging naturally leads to some loss of muscle, but when it happens too quickly, it's a sign that something deeper is occurring. The body may be struggling to digest food properly, or the person may no longer be able to process protein effectively, leading to muscle wasting. This loss of strength doesn't just make movement more difficult, it increases the risk of falls, weakens the immune system, and leaves the person vulnerable to infections. Another reason to lose weight in your last year of life is that your hunger changes. Lots of older people don't get as hungry as they used to, and their sense of taste has changed. As time goes on, fades, they may stop enjoying food and start skipping meals or eating much less. It's not just a matter of taste. This is a bodily change. The body no longer tells the brain to seek food when it senses that it's starting to shut down. This often leads to less energy, less strength, and a gradual decline in general health. There's also the issue of underlying medical conditions. Chronic diseases like cancer, heart failure, and kidney disease often cause people to lose weight. These diseases can start to get worse long before they show more obvious symptoms. Even mental illnesses like depression or cognitive decline can make people eat less, which keeps the body from getting enough fuel to stay alive. Some families try to help their loved ones lose weight by giving them their favorite foods or adding protein drinks to their meals. But if the weight keeps dropping despite these efforts, it's important to know that the problem isn't just the diet. The body is getting ready for a deeper change. At this point, forcing big meals may not help. Instead, focusing on comfort foods that are easy to eat and staying hydrated can make a bigger difference in maintaining quality of life. If you notice that an elderly loved one is losing a lot of weight, especially if they're eating less and feeling weaker or having trouble staying active, it's time to pay attention. This isn't just about how you look. Your body is giving you a message, and understanding that message now can help you get ready for the road ahead with clarity, compassion, and the power to make every moment count. Number 2. Extreme tiredness and weakness. One of the most noticeable changes in the year before death is a deep, constant tiredness that doesn't go away with rest. This isn't just a little tiredness after a long day. It's a profound tiredness that makes even simple jobs seem impossible. It becomes hard to get out of bed. Walking across the room gets harder, and things that used to be easy, like cooking, getting dressed, or even having a conversation, become too tiring. This isn't just a sign of getting older, it's a sign that the body is conserving its remaining energy. As organ function starts to slow, the body starts focusing on what's most important. The heart doesn't pump as efficiently, circulation weakens, and muscles don't get as much oxygen as they used to. This is why many elderly people in their last few months feel weak, unsteady, and unable to keep up the same level of activity they used to enjoy. Metabolism slowing down is another important reason. The body is made to make and use energy, but as it gets ready for its final phase, that energy is redirected. Instead of fueling movement, the body shifts its focus to survival. This is why someone in decline may start sleeping more, needing longer naps during the day, and find it harder to stay awake for long periods of time. Some people may even have rapid drops in, one moment they seem fine, but the next they're totally worn out. But perhaps the most heartbreaking part of this is how being tired makes you feel emotionally. Many seniors, who used to be proud of their independence, start to feel frustrated or even embarrassed that they can't do the things they used to. They may avoid conversations, social interactions, or hobbies, not because they don't care, but because they don't have the energy to do them anymore. This can make them feel alone, and families may stop trying to connect with each other, which speeds up the decline. It can be painful to see a loved one go from being busy and involved to being tired and distant. It's easy to think they're just being lazy, or that they need to push through it, but the truth is that making them do things won't help. What will help is figuring out their limits, letting them rest when they need to, and making their last days as comfortable as possible. If someone you care about is constantly and deeply tired and rest doesn't help, that's a sign that their body is going through a big change. Now is the time to value talks. Create moments of peace and support them without expecting anything in return, because what matters most is that they feel loved, understood, and at ease. If you're still watching this video and finding these insights useful, please leave a comment below to let me know you're here. Also, if you haven't already, please subscribe and turn on the bell so you don't miss any videos. Thanks for your help. We'll keep making good material to educate and motivate you. Let's go. Number 3, cognitive confusion or withdrawal. As a person gets closer to the end of their life, one of the most noticeable changes is in how they think, talk, and interact with others. Someone who used to be sharp and interested may start to forget things more often, have trouble following conversations, or seem lost in familiar places. They may repeat names or lose track of time, even though they never had memory problems before. These subtle cognitive changes can happen months or even a year before death. This isn't just normal forgetfulness. The brain, like any other organ, needs a steady flow of oxygen and nutrients to work right. But as circulation weakens and oxygen supply to the brain drops, cognitive function starts to decline. The person may become easily confused, have trouble making decisions, or have trouble recognizing people in places they've known for years. In some cases, they may even have short periods of lucidity, followed by sudden episodes of confusion, almost as if their mind is fading in and out. Emotional withdrawal is another common sign. People who are getting close to the end of their lives often lose interest in social interactions. You may notice that they talk less, engage less, or just sit in silence for long periods of time. It's not that they don't care about their loved ones, it's just that their brains no longer process emotions and engagement the same way. Conversations get old, loud places feel overwhelming, and eventually they just stop caring. A lot of seniors withdraw into their own world. You may also notice changes in how they act and feel. Some people become more irritable, anxious, or easily frustrated, while others seem strangely calm, detached, or uninterested in things that used to matter to them. This isn't just a change in personality, it's often the brain adjusting to the body's decline as cognitive function slows down. It can be especially hard for family members to see a loved one lose touch with reality or emotionally pull away. But it's important to remember that this isn't something they can control. Instead of trying to get them back into conversations, the best thing you can do is meet them where they are, speak gently, and reassure them that you're still there, even if they don't always respond. If a loved one is forgetful, confused, or less interested, don't ignore it. These are often the first signs that the mind and body are getting ready for the final change. Now is the time to be patient and cherish focus on making a space that feels safe, familiar, and peaceful, because love and comfort can still be felt even when words fade. Now let's move on to number 4, frequent infections, and slow healing. As the body starts to shut down, a weakened immune system is one of the most obvious physical signs. You may notice that someone who rarely got sick before now seems to catch every cold, flu, and small infection that goes around. What used to be minor illnesses now take a lot longer to recover from, and simple wounds like a cut or bruise heal much more slowly. These changes aren't happening by chance. They're signs that the body can't protect itself or heal itself like it used to. One of the biggest worries is getting illnesses over and over again. COVID-19. As your immune system gets weaker, you're more likely to get urinary tract infections, UTI, skin infections, and even oral infections. When these illnesses start to happen more often or take longer to get better, it's often a sign that the body is losing its ability to fight them off. Even antibiotics that used to work quickly may not seem to work as well, and the person may need stronger drugs, longer recovery times, or more than one round of treatment for infections that were once minor. This is because as circulation slows down and organ function declines, the body doesn't respond as well to treatment. Another issue that was ignored. If you notice that small cuts, scrapes, or bruises aren't closing properly or keep opening up, it could mean that your circulation isn't good. When blood flow is low, oxygen and nutrients can't get to the skin and tissues as well as they should. This makes healing much slower than normal. Psoriasis are very dangerous, especially for people who can't move around as easily. If they aren't carefully handled, they can lead to dangerous infections. Even scarier is that infections in the last year of life don't always show up the way we expect them to. Instead of a high fever, an older person may just seem more tired, confused, or less interested in eating. In fact, for seniors, a sudden drop in mental alertness is often the first sign of an infection, even before any other symptoms show up. This is why noticing these changes early can make a difference in how much comfort and support they get in their last years. It can be frustrating and upsetting for families to see a loved one get infections over and over again. Aggressive treatments, hoping that one more round of antibiotics or one more hospital stay will fix the problem. But after a while, the focus shifts from healing to comforting, making sure they stay hydrated, keeping their skin clean and moisturized, and reducing stress on the body can do more for their health than another round of medicine that only makes them suffer longer. If you're still watching this video and finding these insights useful, please leave a note below, number 4, to let me know you're here. Also, if you haven't already, please subscribe and turn on the bell so you don't miss any videos. Thanks for your support. It lets us keep making good material to educate and motivate you. Let's go. Number 5, big changes in breathing or blood flow. A clear change in breathing rhythms is one of the best ways to tell that the body is getting ready for its last stage. You may notice that the person you care about breathes more slowly or shallowly than usual. They may stop between breaths, or their breathing may become irregular, speeding up followed by a pause. Cheney-Stokes respiration is a gentle, rhythmic breathing pattern that some people have. In this pattern, breathing goes back and forth between long stops and deep, quick breaths. Over time, these changes can start out slowly but become more noticeable and more common. Another common sign is poor circulation. You may notice that their hands, feet, or even their nose and ears feel cold to the touch. Their skin may also look pale blue or patterned, especially around their fingers and toes. This is because their body is sending more blood to their vital organs and less to their extremities. It's a clear indication that the heart is not pumping as strongly as before. Some people also experience more shortness of breath, even with minimal movement. Simply sitting up, speaking, or shifting positions might cause them to feel winded or out of breath. You may notice them breathing through their mouth more often, or they may suddenly need to stop and catch their breath while talking if they were once able to walk across the room easily, but now struggle to do so. Their lung function may be declining. In some cases, fluid buildup in the lungs can make breathing more difficult. This can cause a persistent cough, gurgling sounds, or even a feeling of tightness in the chest. Many people assume it's just congestion from a cold, but in elderly individuals nearing the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to ease their breathing. For family members, seeing these changes can be frightening. It's natural to want to help, to encourage them to take deeper breaths, or to worry that something urgent is happening. But in many cases, this is simply the body's natural way of slowing down. There may not always be a way to reverse these changes, but there are ways to make them more comfortable. Keeping the room cool using a humidifier or offering small sips of water can help ease discomfort. In some cases, medications or oxygen therapy can provide relief, but the focus shifts toward comfort rather than trying to fix the issue. If you see these signs, pay attention to changes in breathing, cold hands and feet, or a bluish tint to the skin. These are often signs that the body is conserving energy and circulation is slowing down. Now is the time to be there, reassure them, and make sure they feel safe and at ease in these last few months or weeks. The most important thing you can give them is comfort, dignity, and the knowledge that they are not alone. As this movie comes to a close, take a moment to think about what we've talked about. Significant weight loss. Incredibly tired. Getting worse mentally. Getting infections often and having big changes in breathing and circulation. These 5 signs often show up in the year before an older person dies. They may not all happen at once or be obvious at first, but when you do notice them, it means that the body is getting ready for its final transition. For many families, these changes can be hard to accept. It's natural to want to fight them by telling a loved one to eat more, move more, or push through exhaustion. But sometimes the best thing we can do is listen to what their body is telling us. Instead of trying to change what will happen, we can focus on making their last moments as peaceful, comfortable, and meaningful as possible. Knowing these signs isn't about being afraid of death, it's about being ready for it. If you notice these changes early, you can give better care. Plan ahead for big decisions, and make sure your loved ones are okay with them. An's last months are full of love and respect. This is a time to treasure memories. Sharing stories and letting them know they are valued and not alone can help them find strength, patience, and peace. Thank you for joining us today. We'd love to hear from you. Leave a comment below and tell us one thing you learned today and how you plan to use it in your life. Reading your comments gives us a lot of motivation and encouragement. If you liked this video and found it helpful, please like, subscribe, and share. Your support helps us keep making good content to inform and inspire you. Thanks for watching, and see you in the next video.